One of the common question asked is, can ACL injury be treated without surgery? That's a very relevant question. When we go back a few decades ago, there's something called rule of thirds, where we used to say 1/3 of the patients having ACL injury can be treated without any intervention. 1/3 needed some modification of activities, and another third needed surgery. But when we look at the new world generation, you want to do a lot of activities, and if you have an ACL injury, any pivoting activity can cause further injury to the joint. If you want to get treated without surgery, I would recommend only when you fit in certain criteria. Under 40 patients, better not to think about a conservative treatment, because in the long run, your risk of developing early arthritis is more, because an unstable knee creates abnormal forces on the joint lining that can cause damage to the joint lining, which is the articular cartilage, and also it can cause injury to the discs inside the joint, which also accelerate the arthritic changes in the knee. Over 40s, if your activities are not involving any pivoting movement, yes, you may consider non-operative treatment. However, that needs a long-term rehab. At least 6 months to 9 months of rehab is required. The rehab is mainly to improve the muscle balance, the coordination, and the strength. All these are very important. If you are thinking that I can just ignore, I don't need any surgery, but I'll treat the way the joint is, it is not going to help. Extensive rehabilitation program is what is going to protect your joint from becoming early arthritis. Speak to the doctor and take a detailed consult so that you can understand who you are, because there are many variables, and how your muscles are, how your body weight is, what kind of activities you do. So we factor in several variants to give you a solution for your problem with ACL injury.